Welcome to Oral Surgery Insights. I'm Dr. Russ Lieblick, and I'm pleased to be here with my friend and partner at Beacon Oral Surgeons, Dr. Brandon Rare. Brandon, when we reflect on the advancements within our specialty, the evolution of dental implant therapy consistently stands out as one of the most impactful for our patients.
It truly does, Russ. The ability to replace missing teeth with implants has fundamentally changed how we approach oral rehabilitation. For patients experiencing tooth loss, it offers a solution that is remarkably functional, aesthetic, and durable, closely mimicking natural dentition. It's a significant aspect of the care we provide daily.
Thinking about those patients, whether they've lost a tooth due to an injury, extensive decay, or periodontal issues, the impact can be profound. It affects not just their ability to chew or speak comfortably, but often their self-confidence. Offering them a predictable and long-lasting solution like dental implants is a cornerstone of modern oral surgery.
The science and technology behind it have matured to a point where success rates are exceptionally high, provided there's careful planning and execution. For listeners who might be new to the concept, perhaps a foundational explanation of what a dental implant actually is would be a good starting point.
An excellent idea. At its core, a dental implant is a medical-grade titanium post that is surgically positioned into the jawbone beneath the gum line. This post acts as an artificial tooth root, serving as a strong and stable anchor for a replacement tooth or bridge.
The remarkable aspect of titanium is its biocompatibility. The jawbone naturally fuses directly to the surface of the implant in a biological process known as osseointegration. This creates an incredibly robust and durable foundation, essentially making the implant an integrated part of the jaw. This osseointegration is what distinguishes implants from other tooth replacement options, like conventional dentures or bridges.
That fusion process is truly fascinating from a biological standpoint. The bone cells actively grow onto and interlock with the specially prepared surface of the implant. This results in a replacement that not only looks and feels like a natural tooth once restored by the patient's dentist, but also functions with similar stability and strength.
Precisely. This integration also provides another critical benefit, and preservation of the jawbone. When a natural tooth is lost, the bone that once supported its root can begin to resorb or shrink over time due to a lack of stimulation. Dental implants, by stimulating the bone much like natural roots do, help maintain bone volume and density, which supports facial structure and the health of adjacent teeth.
That bone preservation aspect is so important for long-term oral health and even facial aesthetics. It's a key reason why implants are often considered the gold standard for tooth replacement when clinically appropriate.
Considering who benefits from dental implants, the applications are quite broad. Essentially, any individual who has lost one or more teeth and is in good general health may be a candidate. This could be due to dental trauma, advanced tooth decay leading to extraction, or progressive gum disease.
We see patients across a wide age range: younger patients who have lost a tooth from an accident, adults who have dealt with a problematic tooth for years, or even older individuals who are looking for a more stable and comfortable alternative to removable dentures. The common thread is the desire to restore function and improve their quality of life.
And it's not solely an aesthetic concern, although restoring a natural-looking smile is certainly a significant benefit. Missing teeth, especially in the back of the mouth, where up to 75% of our single-tooth implant cases create functional deficits. Difficulty chewing certain foods can lead to nutritional compromises. Teeth can shift into empty spaces, causing bite problems and potential TMJ issues.
That shifting of adjacent and opposing teeth is a common consequence. Over time, the loss of even a single tooth can disrupt the entire dental arch if not addressed. And as you mentioned earlier, Brandon, the underlying bone loss can eventually lead to changes in facial contours, making someone appear older. Implants help prevent this cascade of events.
So, the indications are numerous, ranging from replacing a single missing tooth to rehabilitating an entire arch where all teeth have been lost. The goal is always to restore not just the missing tooth or teeth, but the patient's overall oral health and function.
Understanding the typical process involved in receiving a dental implant can alleviate much of the apprehension patients might feel. While each case is unique, there's a general sequence of events. It begins invariably with that thorough consultation and meticulous planning phase we discussed.
This involves the detailed medical and dental history review, the clinical examination, and often advanced 3D imaging like CBCT to assess the bone structure and surrounding anatomy. This allows us to determine the optimal implant size, position, and whether any preparatory procedures, like bone grafting, might be necessary. We develop a highly individualized treatment plan.
Once the plan is established and the patient is comfortable proceeding, the surgical placement of the implant is scheduled. This is typically performed in our surgical suite under appropriate anesthesia, ranging from local anesthesia to IV sedation, ensuring the patient is completely comfortable. The procedure involves precisely preparing the site in the jawbone and gently placing the titanium implant fixture.
Following placement, the implant begins the osseointegration process, healing and fusing with the bone. This healing period usually lasts for about 3 to 4 months, sometimes longer, depending on bone quality and other factors. During this time, patients are often able to wear a temporary tooth replacement if needed for aesthetics or function.
After sufficient healing and successful integration, we confirm the implant's stability. Then, the restorative phase begins. This involves attaching a component called an abutment to the implant, which serves as the connector for the final crown or prosthesis. The patient's general dentist then typically takes impressions or digital scans to have the custom-made crown, bridge, or denture fabricated by a dental laboratory.
The final step is the attachment of this custom prosthesis to the abutment, resulting in a fully restored, functional tooth that looks and feels very natural. While it's a multi-stage process, each step is carefully managed, and patients are often surprised at how straightforward the experience can be.
A common question from patients is about bone availability. What if I've been told I don't have enough bone for an implant? It's a valid concern, especially if tooth loss occurred some time ago, leading to bone resorption.
Fortunately, in many such instances, we can successfully rebuild the deficient bone through various bone grafting techniques. This might involve using the patient's own bone, donor bone materials, or synthetic bone substitutes to augment the jawbone, creating the necessary volume and density to support an implant. We've successfully treated many patients who were initially told they weren't candidates elsewhere.
Bone grafting is a well-established and predictable set of procedures in our specialty. While it might add an extra step or healing time to the overall process, it significantly expands the number of patients who can benefit from implant therapy. Neither of us would prefer to do a graft if it's not necessary, but having these tools allows us to achieve results that wouldn't otherwise be possible.
And for patients missing multiple teeth, or even an entire arch, implant-supported dentures or fixed full-arch restorations offer transformative solutions. As few as 4 to 6 strategically placed implants can often provide robust support for a full set of replacement teeth, dramatically improving stability, chewing efficiency, and confidence compared to traditional removable dentures.
The impact on a patient's quality of life in those full-arch cases can be truly remarkable. We've shared some of those second-chance stories through our practice, and witnessing that renewed confidence is incredibly rewarding.
The cost associated with the dental implants is another important consideration that patients naturally have. It's a significant investment in their oral health.
It is an investment, and the cost reflects the advanced materials used, such as medical-grade titanium, the precision components, the sophisticated diagnostic and surgical techniques involved, and the expertise required from both the surgical and restorative teams. We always discuss this transparently during the consultation. It's also worth noting that implants are designed as a long-term solution.
That's a key point. Unlike traditional bridges or dentures that may require replacement or significant adjustments every 5 to 15 years, well-maintained dental implants can last for many, many years, often a lifetime. When you factor in this longevity and the functional benefits, such as preserving jawbone, preventing adjacent teeth from shifting, and avoiding the recurring costs of other less durable options, the long-term value becomes very clear.
And maintenance for dental implants is generally quite straightforward, closely mirroring the care for natural teeth.
Indeed, regular brushing twice a day, flossing or using other interdental cleaners, and routine professional checkups and cleanings with their general dentist are essential. While the implant itself cannot decay, the surrounding gum tissue and bone must be kept healthy to ensure the implant's continued success. Good oral hygiene is paramount.
Before we conclude, Brandon, any final thoughts or advice for individuals considering dental implants?
I would emphasize the importance of selecting an experienced oral surgeon for the surgical phase of implant treatment. Successful outcomes begin with meticulous planning, thorough assessment of the patient's anatomy and health, and precise surgical technique. These are skills honed through years of specialized training and daily clinical practice. We perform these procedures routinely, but that may not be the case for all practitioners. Don't hesitate to inquire about a surgeon's experience and training, and certainly feel comfortable asking questions during the consultation. An informed patient is an empowered patient.
Well said. This has been a good introductory overview, I think. We've touched upon what dental implants are, who can benefit, the general process, and some key considerations. Our hope with Oral Surgery Insights is to provide this kind of foundational clarity on various topics within our field.
Agreed, Russ. It's a broad subject, and we've aimed to cover the essentials today. We have a number of areas we're looking forward to discussing in upcoming episodes, and we certainly hope our listeners will find these conversations valuable. We also welcome any questions or topic suggestions as we move forward.
Thank you for joining us for this discussion on Oral Surgery Insights. We appreciate you tuning in and look forward to our next conversation.